If you're someone that experiences quite a lot of back pain when barbell squatting, I want to show you a possible reason why that might be happening. For a lot of people, it's hard to differentiate between movement of the pelvis versus hinging of the hips. So the first thing we want to look at, we'll look at an example in a moment with the barbell. We want to first look at the actual structure of the hips and where the movement is occurring from. So the first thing to differentiate between is what is a pelvic tilt. So the pelvis is sort of the bony structure here that you'll see. It houses the two sort of ends of your femurs. It's kind of like, it looks like elephant ears and just connects to the bottom of the sacrum of the spine, okay? So the idea here is we've got two movements to differentiate between. We've got tilting of the pelvis, which is sort of a back and forth motion. You can see from here the idea is I can go for what's considered a posterior tilt. I've got a lot more tension in my glutes. I even sort of flatten out my lower back in some way. And then I've also got an anterior tilt. You'll see this sort of like duck back posture. My sacrum ends up sort of tilting. My lumbar spine goes into a lot more extension, and you can see this sort of different posture that I'm in as a result. Now what that has is it has an effect up and down my spine as a result. So when I tilt my pelvis, you can see lumbar spine goes into a lot more extension and rib cage flares up quite a bit. Versus the opposite way, when I posteriorly tilt, I've got a much more what's considered a neutral spine. My rib cage is down, I'm in a much better position. You'll see I'll put up a graph up which will kind of show you the difference between what's considered like a closed canister and an open canister. And we can see in a second here why that's maybe not the best thing for back pain. So having a look here, let's set ourselves underneath the bar and set the barbell over to the side here. You're going to see this best from sort of a side angle like this. So if I set myself up into what would be considered a poor rep, where I go into that tilt of the pelvis by accident, you can see from here I'm almost like moving, tilting my pelvis, flaring up my rib cage and getting lots of lumbar extension into my spine. Now the reason why this might be bad is because I've got a lot of movement back and forth of my spine as a result. It looks like I'm moving at my hips, but it's actually a tilt of the pelvis as I go down. So that kind of flexion and extension movement, especially when the barbell is loaded up with a heavy weight, wouldn't be the best thing for lower back pain. Now, doing this the optimal way would be looking at that closed canister, thinking of rib cage tucking down, my pelvis posteriorly tilting almost a little bit, and then from here staying braced and engaged around my midsection and hinging at the hips. That hinge will look like this, where I actually push my bum back versus tilting the pelvis. Okay, so that push back means that my rib cage is going to stay down, my back is going to stay straight, my core is going to stay a lot more braced as I go down into position. And I'm certainly not feeling any sort of pinching, closing pain on my lumbar spine as I go through. So certainly lower back pain during squatting can be quite difficult to comprehend, and there can be many different issues or many different reasons why it might happen. But there's a possible example and a quick fix for something to try the next time you're squatting.